Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. While attempting to get out of bed, a patient accidentally disconnects the chest tube from the pleurovac drainage system. Which of the following actions should the nurse take first? A. Insert the end of the chest tube in a container of sterile solution. B. Clamp the chest tube near the pleurovac drainage system. C. Raise the end of the chest tube above the level of the insertion of the chest tube. D. Apply pressure dressing to the chest tube insertion site. The answer is option A. Insert the end of the chest tube in a container of sterile solution. 2. Which type of isolation category is indicated for a burn patient? A. Airborne isolation. B. Strict isolation. C. Reverse isolation. D. No isolation required. The answer is option C. Reverse isolation. 3. Which type of isolation category is indicated for patient with diphtheria? A. Airborne. B. Droplet. C. Blood. D. Contact. The answer is option D. Contact. 4. A 68-years-old woman diagnosed with thrombocytopenia due to acute lymphocytic leukemia is admitted to the hospital. The nurse should assign the patient to A. Add description here. A. To a private room so she will not infect other patients and healthcare workers. B. To a private room so she will not be infected by other patients and healthcare workers. C. To a semi-private room so she will have stimulation during her hospitalization. D. To a semi-private room so she will have the opportunity to express her feelings about her illness. The answer is option B. To a private room so she will not be infected by other patients and healthcare workers. 5. A nurse who begins to administer medications to a client via a nasogastric feeding tube suspects that the tube has become clogged. The nurse should take which safe action first? A. Aspirate the tube. B. Flush the tube with warm water. C. Prepare to remove and replace the tube. D. Flush with a carbonated liquid such as cola. The answer is option A. Aspirate the tube. 6. Which of the following instructions is appropriate for the nurse to give to a female client who complains of abdominal upset after cholecystectomy operation? A. Increase fluid intake. B. Avoid fatty meals. C. Increase protein intake. D. Daily exercise. The answer is option B. Avoid fatty meals. 7. Which of the following pulses should be checked before administering digoxin? A. Apical pulse. B. Radial pulse. C. Femoral pulse. D. Dorsalis pulse. The answer is option apical pulse. 8. Which type of isolation category is indicated for patient with tuberculosis? A. Airborne isolation. B. Strict isolation. C. Reverse isolation. D. Contact isolation. The answer is option A, airborne isolation. 9. Which of the following interventions must the nurse take when administering digoxin to the patient? A. Give him the medication with a glass of orange juice. B. Check him for signs of hypokalemia before giving the medication. C. Instruct him to place the medication under the tongue. D. Withhold the medication if his pulse is less than 60 beats/minute. The answer is option D. Withhold the medication if his pulse is less than 60 beats/minute. 10. The nurse must withhold digoxin from a patient if his pulse rate is less than 45/m, B. more than 60/m, C. less than 60/m, D. more than 100/m. The answer is option C, less than 60/m. 11. The nurse is assessing the client for possible evidence of digitalis toxicity. The nurse acknowledges that which is included in the signs and symptoms for digitalis toxicity: A. Pulse, heart rate of 100 beats/min, B. Pulse of 72 with an irregular rate, C. Pulse greater than 60 beats/min and irregular rate, D. Pulse below 60 beats/min and irregular rate. The answer is option D, pulse below 60 beats/min and irregular rate. 12. A newly admitted client takes digoxin 0.25 mg/day. The nurse knows that the serum therapeutic range for digoxin is A. 0.1 to 1.5 nanograms per milliliter, B. 0.5 to 2.0 nanograms per milliliter, C. 1 to 2.5 nanograms per milliliter, D. 2.0 to 4.0 nanograms per milliliter. The answer is option B, 0.5 to 2.0 nanograms per milliliter. 13. A patient complains of severe pain which he stated to be 9/10. The physician ordered morphine 50 milligrams for every 4 hours. The last dose was given 2 hours ago. What is the best action his caring nurse would take? A. Give another dose of morphine. B. Inform the doctor to change the order. C. Distract the patient by TV, radio or games for 2 hours. D. Ignore the patient completely. The answer is option B, inform the doctor to change the order. 14. The nurse is caring for a patient admitted 1 week ago with an acute spinal cord injury. Which of the following assessment findings would alert the nurse to the presence of autonomic dysreflexia, hyperreflexia? A. Tachycardia, B. Hypotension, C. Hot, dry skin, D. Throbbing headache. The answer is option D, throbbing headache. 15. Which of the following is the best way for long-term feeding for a patient experiencing severe dysphagia? A. NGT, B. Nasoduodenal tube, C. Gastrostomy, D. parenteral. The answer is option C, gastrostomy. 16. Patient records are as following. He had 650 cubic centimeters of 4 fluid, N/S, 50 milliliters of orange juice in the NG tube, 100 water with the medications, and urinate 500 cubic centimeters, and 100 cubic centimeters collected in the NG bag, what is the total intake for this patient? A. 800 cubic centimeters. B. 650 cubic centimeters. C. 200 cubic centimeters. D. 600 cubic centimeters. The answer is option A, 800 cubic centimeters. 17. The physician ordered to give the patient 10,000 unit of heparin. The preparation available is 40,000 milliliter. How much would the nurse give this patient? 4 milliliters. B. 2.5 milliliters. C. 0.25 milliliters. D. 25 milliliters. The answer is option C, 0.25 milliliters. 18. The nurse is caring for a client with a fracture. The client develops a deep vein thrombosis in the opposite extremity. Physician orders include a heparin drip of D5W 250 milliliters with heparin 12,500 units at 16 ml/hr. How many units of heparin is this client receiving per hour? 200 units/H. B. 400 units/H. C. 600 units/H. D. 800 units/H. The answer is option D, 800 units/H. 19. A patient suffers from diarrhea and muscle weakness. The nurse would assess this patient for which of the following abnormal laboratory blood tests? Blood calcium. B. Blood magnesium. C. Blood potassium. D. Blood sodium. The answer is option C, blood potassium. 20. When assessing for therapeutic effects of mannitol, the nurse would expect to see decreased intracranial pressure, B. Decreased excretion of therapeutic medications, C. Increased urine osmolality, D. Decreased serum osmolality. The answer is option A, decreased intracranial pressure. 21. Which drug would be used to treat a patient who has increased intracranial pressure, ICP, resulting from head trauma after an accident? A. Mannitol. B. Atropine sulfate. C. Epinephrine hydrochloride. D. Sodium bicarbonate. The answer is option A, mannitol. 22. Which of the following is the drug of choice for treatment of cerebral edema? A. Mannitol. B. Atropine sulfate. C. Epinephrine hydrochloride. D. Sodium bicarbonate. The answer is option A, mannitol. 23. The nurse would assess which laboratory value to determine the effectiveness of intravenous heparin? A. Complete blood count, CBC. B. Activated partial thromboplastin time, APTT. C. Prothrombin time, PT. D. BUN. The answer is option B, activated partial thromboplastin time, APTT. 24. The antidote to heparin is A. Aspirin. B. Vitamin K. C. Warfarin. D. Protamine sulfate. The answer is option C, warfarin. 25. How do we monitor the effectiveness of Coumadin, warfarin? Monitor vital signs. B. PT/INR. C. Weight. D. Ask the patient how they feel. The answer is option B, PT/INR. 26. Which medication is used to treat a patient suffering from severe adverse effects of a narcotic analgesic? A. Naloxone, Narcan. B. Acetylcysteine, Mucomyst. C. Methylprednisolone, Solomedrol. D. Protamine sulfate. The answer is option naloxone, Narcan. 27. A patient who has been anticoagulated with warfarin, Coumadin, is admitted with gastrointestinal bleeding. The nurse will anticipate administering which substance? A. Vitamin E. B. Vitamin K. C. Protamine sulfate. D. Calcium gluconate. The answer is option B, vitamin K. 28. While admitting a patient for treatment of an acetaminophen overdose, the nurse prepares to administer which of the following medications to prevent toxicity? A. Naloxone, Narcan. B. Acetylcysteine, Mucomyst. C. Methylprednisolone, Solomedrol. D. Vitamin K. The answer is option B, acetylcysteine, Mucomyst. 29. If the nurse gave a patient antihypertensive drug that is prescribed for another patient, what should she do? A. Ignore what she has done. B. Call urgent CPR. C. Document that in nursing report. D. Inform doctor after 2 days. The answer is option D, inform doctor after 2 days. 30. When a physician orders an arterial blood gas, which artery is the appropriate one to use to obtain the specimen? Cerebral artery. B. Radial artery. C. Carotid artery. D. Ulnar artery. The answer is option B, radial artery. 31. A client has an order to have a set of arterial blood gases, ABGs, drawn. The intended site is the radial artery. The nurse ensures that which of the following is positive before the ABGs are drawn? A. Hohmann's sign. B. Brudzinski's sign. C. Babinski reflex. D. Allen's test. The answer is option D, Allen's test. 32. A client is scheduled for blood to be drawn from the radial artery for an ABG determination. A nurse assists with performing Allen's test before drawing the blood to determine the adequacy of the A. Ulnar circulation. B. Carotid circulation. C. Femoral circulation. D. Brachial circulation. The answer is option, ulnar circulation. 33. A nurse has administered approximately half of an enema solution to a preoperative client when the client complains of pain and cramping. Which nursing action is the most appropriate? A. Raise the enema bag so that the solution can be instilled quickly. B. Clamp the tubing for 30 seconds and restart the flow at a slower rate. C. Reassure the client and continue the flow. D. Discontinue the enema and notify the physician. The answer is option B. Clamp the tubing for 30 seconds and restart the flow at a slower rate. 34. When caring for a client who is receiving total parenteral nutrition, TPN, which of the following complications would be most important for the nurse to assess? Chest pain, B. Hemorrhage and air embolus, C. Pneumonia and hyperglycemia, D. Electrolyte imbalance and sepsis. The answer is option D. Electrolyte imbalance and sepsis. 35. A client has a nasogastric tube after a gastric resection. The nurse should expect to observe A. Vomiting, B. Gastric distension, C. Intermittent periods of diarrhea, D. Bloody drainage for the first 12 hours. The answer is option D. Bloody drainage for the first 12 hours. 36. While assessing a client with hypoparathyroidism, the nurse taps the client's facial nerve and observes twitching of the mouth and tightening of the jaw. The nurse would document this finding as which of the following? Positive Trousseau's sign, B. Positive Chvostek's sign, C. Tetany, D. Hyperactive deep tendon reflex. The answer is option B. Positive Chvostek's sign. 37. Which of the following clinical manifestations of type 2 diabetes occurs if glucose levels are very high? A. Hyperactivity, B. Blurred vision, C. Oliguria, D. Increased energy. The answer is option B. Blurred vision. 38. Which of the following would the nurse expect to find in a client with severe hyperthyroidism? A. Tetany, B. Buffalo hump, C. Exophthalmos, D. Striae. The answer is option C. Exophthalmos. 39. A client is receiving long-term treatment with high-dose corticosteroids. Which of the following would the nurse expect the client to exhibit? A. Weight loss, B. Pale thick skin, C. Hypotension, D. Immune face. The answer is option D. Immune face. 40. When admitting a client who is in labor to the birthing unit, a nurse asks the client about her marital status. The client refuses to answer and becomes very agitated, telling the nurse to leave. How should the nurse respond? A. Question the family about the client's marital status. B. Try to obtain this information to complete the client's history. C. Refer the client to the social service department for counseling. D. Ask questions that are restricted to the client's present clinical situation. The answer is option C. Refer the client to the social service department for counseling. 13. After an abdominal cholecystectomy, a client has a T-tube attached to a collection device. On the day of surgery, at 10:30 p.m., 300 milliliters of bile is emptied from the collection bag. At 6:30 a.m. the next day, The bag contains 60 milliliters of bile. What should the nurse consider in response to this information? A. The T-tube may have to be irrigated. B. The bile is now draining into the duodenum. C. Mechanical problems may have developed with the T-tube. D. Suction must be re-established in the portable drainage system. The answer is option C. Mechanical problems may have developed with the T-tube. 22. Medication is prescribed for a 7-year-old child with attention deficit hyperactivity disorder, ADHD. What information should the school nurse emphasize when discussing this child's treatment with the parents? A. Tutor their child in the subjects that are troublesome. B. Monitor the effects of the drug on their child's behavior. C. Explain to their child that the behavior can be controlled if desired. D. Avoid imposing too many rules because these will frustrate the child. The answer is option B. Monitor the effects of the drug on their child's behavior. 43. A nurse is supervising a recently hired nursing assistant who is caring for a debilitated, bedbound client. What intervention being implemented necessitates the nurse to intervene? A. Draining the client's urinary collection bag into a measuring container. B. Taking the client's blood pressure with an electronic sphygmomanometer. C. Removing boots that kept the client's feet in dorsiflexion before giving a bath. D. Replacing a dressing on the client's buttocks that was contaminated with fecal material. The answer is option D. Replacing a dressing on the client's buttocks that was contaminated with fecal material. 44. A client is receiving epoetin, Epigen, for the treatment of anemia associated with chronic renal failure. Which client's statement indicates to the nurse that further teaching about this medication is necessary? A. I realize it is important to take this medication because it will cure my anemia. B. I know many ways to protect myself from injury because I am at risk for seizures. C. I recognize that I may still need blood transfusions if my blood values are very low. D. I understand that I will still have to take supplemental iron therapy with this medication. The answer is option A. I realize it is important to take this medication because it will cure my anemia. 45. A patient with COPD is admitted to the hospital. How can the nurse best position the patient to improve gas exchange? Sitting up at the bedside in a chair and leaning slightly forward. B. Resting in bed with the head elevated to 45 to 60 degrees. C. In the Trendelenburg's position with several pillows behind the head. D. Resting in bed in a high Fowler's position with the knees flexed. The answer is option, sitting up at the bedside in a chair and leaning slightly forward. 46. Adiabetic patient with foot gangrene undergone above knee amputation. He complain of pain and swelling at the wound site which is oozing pus and has a bad odor. The physician ordered cephalexin and metronidazole. Which of the following you should do immediately? A. Give cephalexin direct first action. B. Give metronidazole direct first action. C. Do wash on wound with N/sand put bacitracin. D. Do wash on wound with N/sand put hydrocortisone. The answer is option C. Do wash on wound with N/sand put bacitracin. 47. To protect susceptible patients in the hospital from aspiration pneumonia, the nurse will plan to A. Turn and reposition immobile patients at least every 2 hours. B. Position patients with altered consciousness in lateral positions. C. To monitor frequently for respiratory symptoms in patients who are immunosuppressed. D. Provide for continuous subglottic aspiration in patients receiving enteral feedings. The answer is option B. Position patients with altered consciousness in lateral positions. 48. The nurse is caring for a patient receiving 4-furosemide, Lasix, 40 mg and enalapril, Vasotec, 5 mg PO bid for ADHF with severe orthopnea. When evaluating the patient response to the medications, the best indicator that the treatment has been effective is A. Weight loss of 2 pounds overnight. B. Improvement in hourly urinary output. C. Reduction in systolic BP. D. Decreased dyspnea with the head of the bed at 30 degrees. The answer is option D. Decreased dyspnea with the head of the bed at 30 degrees.
Thank you for watching.